Thank you, Governor, Lieutenant Governor. Good afternoon, everyone. First of all, a look at our numbers today. We have confirmed 25,250 cases in Ohio. That is up 473 from yesterday. Now we have 1,436 Ohioans who've been lost to COVID-19. That was 79 deaths reported since yesterday. Next slide. Again, we have this age range going up to 108 now, and our numbers still skewing toward the male, actually, with 54% of our cases being male. Next slide. Trends, again, we're keeping those 21-day trends for you. So much more data like this on our website for you to take a look at. We see the ups and downs, but overall, still in a very flat plateau phase. Next slide. And again, our testing numbers going up. Sometimes we'll see some decreases on a day or two over the weekend, Governor. Sometimes we see a few less tests, but we're still moving upwards in that area. I want to also share, because we're going to talk a little bit today about nursing homes. We now know that, of course, most of our testing has gone to high-risk situations, hospitals, frontline workers, and of course, nursing homes. Long-term care residents make up 16% of the cases that we just shared with you, and they make up, in our state, 22% of the deaths that we see. Obviously, this is an issue we worry about. I want to say something really important here. We started a new process. During this, it was data we never collected before on the deaths and more data on long-term care facilities. I want to say that, one of the most important things that has been asked by CMS, and we certainly do in our state, is ask that nursing homes talk with family members whenever they have a case or an outbreak. It doesn't mean necessarily that a nursing home has done something wrong. This is a very contagious disease, obviously a very deadly disease, and getting in a nursing home, even in the best of practices, can happen. I think that's really important to say. What's most important is that we're transparent and let you know that, and then we handle that outbreak very effectively. That's one of the things that Director Corcoran will be talking to you about next. But one of the things we realized is this would be a high-risk population for us. And in Ohio, we've been working tirelessly on making nursing homes safe from the very beginning. But I want to say to the workers out there, I've said this before, the workers who work every day to help, it's one of the most painful parts of this pandemic for many of us is having relatives and people we love that we can't go visit. We've had to limit some of the things we normally do. And that is, tragic, at the same time trying to protect the people we love. So I just want to acknowledge that. And, a nursing home shouldn't be ashamed to have a case. The number one thing for a nursing home, for any of our businesses who are opening up again, I say to you, like the lovely business we just saw, ask for help if you start to see something that just doesn't feel right, whether it's in a prison, whether it's in a homeless shelter, whether it's in a business. Call your local health department. We stand ready to help talk you through it. We'll bring in the best experts we can to help you figure out the best solutions. It really is going to take all of us. I just want to share with you a quote from Peggy Noonan. It was an article she had written in the Wall Street Journal this past weekend. We have to cooperate by doing the things that contain the illness so that our businesses can stay open and keep functioning. Wearing a mask isn't a sign of submission, as some have said. It's really a sign of respect, responsibility, and economic encouragement. It says, I'll do my small part. So it really is a safety we're doing as we go about not only to keep ourselves safe, keep others safe, but really help the most amazing small business. These businesses, especially these small businesses, are our babies, they're our children, they're our act of creation. And it really is what we can do to keep this economy open and to keep those people who are really doing everything they can to stay open safe. So once again, don your mask, don your cape, and let's help these Cape Crusaders we saw today keep that business open for all of us. Thank you.